Good morning, everybody. Stephen Boylan here again. So today what I'm going to be talking through with you is I'm going to be talking through what is cognitive behavioural therapy. So I'm going to give you a breakdown of what cognitive behavioural therapy actually is. So I'm going to do that by explaining first of all how cognitive behavioural therapy first started. So if you think we're going way back into the very first wave of what we call cognitive behavioral therapy, which was behavioral therapy. That was the first wave. Cognitive behavioral therapy comes now in three waves. So the first wave was the behavioral therapy, then along came cognitive therapy, and then along came what we know as mindfulness and stuff, which is quite popular nowadays. So they're the three waves that cognitive behavioural therapy has come in up to date. So in terms of cognitive behavioural therapy, we're looking at basically the aim of behavioural therapy is to help people to change their behaviour, to help them to reduce the levels of distress. So for example, somebody who has a fear of spiders, when they see a spider, they will run away. So because they run away, what happens there is their brain learns that by running away, they can feel better. So the next time they see a spider, they will run away again and again and again. So what's happening there is their brain is learning that by running away, that their anxiety reduces. So they keep on doing it. So they keep on avoiding the spider. So that by avoidance is what's maintaining the phobia of spiders. So what the aim of that is to help people to face their fears by asking them to, first of all, set what we call an hierarchy as where we would work our way up to the ultimate goal. Maybe the ultimate goal is holding the spider. So we would build our way up. So we might build it up by using, looking at pictures first of all. Then it might be looking on the internet at spiders. Then it might be having a live spider in the room. Then it might be having a spider out of, in a jar, in the room, and then it might be out of the jar, and then the ultimate one might be where they actually hold the spider, and then that way we'll be gradually overcoming that avoidance behaviour, what is maintaining their anxiety, and therefore by facing the fear head on, it would reduce naturally rather than erratic coming down like that when they run away. So we're training the brain that by facing it bit by bit, that the anxiety will come down as well. So we're re-educating the brain that it will come down anyway, the anxiety. With anxiety, what comes up must come back down again. So I always use the analogy, if you think of a snow globe when you shake it, all the snow goes everywhere, and then eventually that snow settles back down. So that is a way of explaining that anxiety will settle back down. So although sometimes people don't think that anxiety is going to settle back down, so eventually it will do. So that's just a little bit of an example of behavioral therapy. So then along came cognitive therapy. So cognitive therapy is about challenging our what we call negative automatic thoughts about particular situations or about ourselves. So we might be thinking negative about ourselves. So I'm a failure, I'm no good. So some of these are what we call a little bit more deeper in there into our core beliefs, which we go more into obviously in the CBT course. But by thinking like that, what that does is create a lot of distress and low mood. So the aim of cognitive therapy is not to think positive, because it's hard to think positive when you're so distressed. It's about trying to rationalize the thought. So, we would, well, all right, then, what evidence suggests that you're a failure? Well, they might come up with a few things. What evidence suggests that you're not a failure? So we're trying to rationalize the thoughts, and then from that we would try and create a new thought by creating that new thought by summarizing the evidence against that negative thought. So it's about challenging and reevaluating and reappraising our thoughts rather than thinking positive. So that's a little bit about cognitive. Obviously, there's more to behavioral therapy and more to cognitive therapy. Mindfulness, I've not done a great deal of training in mindfulness, so I'm not going to sort of speculate on mindfulness because that is not an area that I'm trained in. But obviously, there's lots and lots of people out there who are trained in mindfulness, and obviously, if that's something that you wanted to know more about, hopefully during the course, what I'm going to be delivering online, I'm going to bring somebody in who will be talking a little bit more about mindfulness. Somebody who's got a better understanding of it than what I have myself. I have a good understanding of cognitive and behavioural therapy, but not sort of mindfulness. So I'm not going to speculate. I'd rather leave that to somebody who knows exactly what they're talking about in that sense. But that's just to make you aware that there are three waves of cognitive behavioural therapy anyway. So, and they all make, both cognitive and behavioural therapy make up CBT and mindfulness as well. And obviously we've got we're going into the new sort of category of CBT now, which is EMDR, which is a new sort of type of cognitive behavioural therapy as well. But again, I'm not trained in that, so I'm not going to speculate on that too much. But we're always in the CBT world looking for new sort of treatments, new intervention, new different things. So, new things are always coming up all of the time. So that's basically a little bit about what the background and the different areas. Obviously, I'll go more into the different theorists who sort of came up with sort of behavioural therapy, cognitive therapy. Obviously, when we do the actual course, you'll learn more about all of that if you choose to do the course as well. Also, what I want to go over now is just a brief explanation of how CBT sort of works. And I'm going to focus on what we call the 5 areas model. This is a model designed by Christine Pedesky, who is a cognitive therapist, primarily uses cognitive therapy over sort of the general cognitive behavioural therapy, but she does use other stuff as well, and she's said to be one of the best in cognitive behavioural therapy, one of the most effective therapists, and she's also a very good trainer from people who have spoken to as well. So this model is called the 5 areas model, and basically the 5 areas is made up of, we have an environment or situation, which is something that would trigger off our thoughts, our behavior, our body sensations, and our emotions. And what the basis of CBT is that all of them are all interlinked. So basically we have a situation. So for example, I'm in my office now. If I was, to think that something's going to happen, like I'm going to get run over when I leave the office, then I'm going to be sort of really anxious, and I'm not going to leave the office. I'm going to get all these physical sensations. So the situation is, I'm in the office thinking that, basically I'm going to get run over when I leave here. Then the emotion is extreme anxiety. The behaviour is, I won't leave here, I'm avoiding leaving. The body sensation is heart beating fast, all the rest of it. So, but if I was to sort of rationalise it, so, well, I've left here lots of times before, and I've never been run over. I've never been run over anywhere in my life before, so, and I'm pretty cautious when I do cross roads and stuff. So then when I start to rationalise it, well, what is the risk? What is the overall chance of me actually actually getting run over. So I would reevaluate and reappraise that negative thought into a more rational and realistic and balanced thought. So that's what I would do, and that would reduce some of the anxiety. And then by leaving here and not getting run over, if I didn't get run over, I would be reducing my anxiety as well naturally. So the behaviour part kicks in there, and then the body sensations would settle down, and the overall level of anxiety would settle down too. So we're letting it progress down rather than erratic in CBT. We don't want it to jump straight back down the anxiety, because that would not be allowing the anxiety to reduce naturally. So if you think one of the main overall difficulties what people experience and what they come to CBT with is the using a lot of what we call safety seeking behaviours, and safety seeking behaviours are generally what's maintaining the problem. So like I was talking about the spider phobia before, the more you run away when you see a spider, that's what we call a safety behaviour. Again, me not leaving the office here, that would be another safety behaviour. So all of these different safety behaviours would be maintaining the anxiety and distress, and then could lead to other problems like depression. Generally, you'll find depression and anxiety come hand in hand because they're like brother and sister. So somebody who has an anxiety disorder or problem will generally have a depression as well. So 9 out of 10 times, or a good percentage of the time, we would treat the anxiety over the depression. But every case is different, so obviously the assessment and formulation would decide on which way you would be dealing with that client. But generally, we would go for treating the anxiety, because that would be maintaining a lot of the depression anyway. But like I say, every case is different, so we want to make sure we work within that client's capabilities and also work from the client's frame of reference along collaboratively with the therapist. So in CBT, it's always in a collaborative approach where we work together to address the problem. So it's a bit of an educational process, CBT. It's a bit of it's a practical approach. It's a solution-focused treatment, and it's sort of structured as well, in the sense that you always set an agenda at the beginning of every session, which would generally begin with the homework, what you've given previously to do, and then you would go through whatever else you're going to be doing based on your treatment plan and formulation. So CBT is a very structured approach. And I mean, that's a general overview of what CBT. I hope sort of that gives you a better insight into what CBT actually is. Obviously, the next installments I'm going to be on in the next video you'll find underneath this or above this is I'm going to be talking about what CBT is actually good for treating, because CBT is obviously primarily good for treating depression and anxiety, but it's also good for lots of other things as well. So I'll be sharing that and explaining a bit more about the different treatments and what it's good for in the next video. So thank you for watching this video, and I'll see you in the next video. Thank you and goodbye.